and welcome to Scottish Drugs Forum, and thank you for taking part in the filming today. Could you just introduce yourselves and a little bit about your role?
My name's Emma, and these are my colleagues Lynsey and Caroline.
Hi.
So we're all sexual health nurses, also known as sexual health advisors, based in the Sandyford in Glasgow. So we're all registered nurses with many years' experience of working in sexual health, and our role there is to help and support clients with issues relating to their sexual health. So this will include things like tests for sexually transmitted infections and bloodborne viruses, and also treating those infections if they are indeed positive. Also, a key component of this work is a process called partner notification or contact tracing, which is a term that we're kind of preferring to use in the work that we're doing at the moment. So we know that contact tracing has a really good effect in reducing the onward transmission of HIV for people who have sexual risk, and we also think that there is a real possibility that it can really have a benefit in reducing the onward transmission for people who inject drugs and the risks to sharing needles. So in light of the current HIV outbreak in Glasgow at the moment, we've been asked to utilise that experience and work alongside the homeless and addictions team by carrying out contact tracing for these clients that are HIV positive. What we hope is that this is going to really make a difference in reducing the HIV outbreak at the moment, primarily by getting those who are still at risk of the infection tested, also doing some education with them, and hopefully we'll find that that's a success.
So lots of new learning then there. Do you want to just tell us a little bit more about this contact tracing or partner notification?
Yes.
So what it is generally and maybe what the differences are?
Yeah. So traditionally it was always called partner notification, but given the situation that we find ourselves in with the outbreak, we've chosen to call it contact tracing. We feel that's, first of all, it's more relevant because we are dealing with not just sexual contacts, but also dealing with injecting partners as well. And for some people, I think partner notification just didn't fit the bill, really. So contact tracing, the phenomenon has been around since the 1940s. And the premise really is to break the chain of infection, to stop onward transmission. So it has a kind of public health perspective to it. And what we would do would inform contacts or people who have been named by the person who's been diagnosed with a specific sexually transmitted infection, such as gonorrhea, chlamydia, or a bloodborne virus such as HIV, hepatitis B or C. And we would let the contact know that they've been named and it's worthwhile that they get checked up and, if required, treated. We found that there's two strands to partner notification. One is like dealing with the individual and the contacts, but also there's a broader perspective looking at clusters of infections. And this is particularly relevant given the outbreak, because we might look at patterns of where we're seeing or hearing people potentially getting infected. The same name may come up a few times, so it's very important that we home in on that.
Yeah.
That's also why sexual health advisors historically have been kind of the ones to do this. It's been found that if you dedicate a group of people to look at this specifically, the outcomes are better, because it's not just a kind of tagged on at the end of another job, it's actually a piece of work and it takes some time. Confidentiality is key with partner notification. For people to trust us to disclose information about the partners, they've got to understand what we're going to do with that information. And it's really important that we spell that out to them.
Yep.
We also realise that it's futile just to deal with the person who has the infection, because what may happen is we may treat them and then they might go back into the same relationship and get reinfected, and there can be medical consequences to that can affect their health. The other side is, let's say it's a one-night stand or a casual situation or a brief intervention of injecting with somebody, and they're never informed, then obviously the public health issue, they then may inject with somebody else again or have sex with them again, and then we're dealing with an undiagnosed pool of infections, for example with HIV, and therefore clearly if someone isn't treated for HIV, then there can be serious consequences to that, to their health and to other people.
So there's a real public health remit then to the work that you're doing, and prevention as well.
Yeah. There's some practical ways we do this. So one's called a patient referral. So the person with the infection is called the index client, and
Okay.
the person that they name is called the contact. So depending on what the infection is, and depending on whether they've had a negative test before, will depend how far back we go back, and that's called the tracing period. So what will happen is we'll identify what the tracing period is. So it could be 6 months in some cases, it could be a lifetime of sexual injecting history. We would ask the client to recall. Some people find that really easy actually, some people obviously don't. And we would ask for specific names, details, dates of births, and ask them if they feel comfortable speaking to them, the contact, about that. And actually that has been proven to have the most successful outcome. If the index person is self-motivated, generally you find that we have good outcomes. And we would then follow that up and just see behind the scenes whether that person has been seen at a clinic or checked or treated or whatever. The other option is a provider referral. And this is where, for whatever reason, the index client doesn't want to go directly to the contact. And there could be various reasons for that. It could be that they're just embarrassed. It could be that it was just a very casual one-night stand. No desire really to see that person again, but they kind of get it. They get the public health issue. There also could be an issue of gender-based violence as well. It would not be safe for them to approach that person. So that's when we would offer, we come in. We would offer to then contact that person directly, and that could be by email, phoning, post. And what's crucial though is that we would make sure that the index details remains anonymous and confidential. So we would never disclose to that contact where that information came from. So for example, I would phone somebody and say, you've been in contact with somebody who has HIV, and naturally, human nature says, who is it? And we would say to them, well, I'm afraid we can't tell you, just like if you came to our clinic, we wouldn't disclose anything about you. And then that gives them the opportunity to come in and get tested or treated, and you know, and really what we're trying to do is break the chain of infection. So these are two main ways that we go about the actual practical process of contact tracing.
It's quite a lot of work involved then.
A lot behind the scenes.
A lot behind the scenes.
Yeah.
So Lynsey, could you tell us more about how your role has changed since the HIV outbreak in people who inject drugs in Glasgow?
So the biggest change for us is that we have now based ourselves within the Homeless Health Centre at Hunter Street and also the Glasgow Drug Crisis Centre. So that's allowing us to work directly with the community and also to work with members of those teams who are able to identify anyone who would benefit from our input. So this means that we are working face-to-face with HIV positive clients when they attend the HIV clinic at Hunter Street, but also being able to offer sexual health provision and HIV testing support to service users at both sites. Our aim is to identify anyone who would be a priority for HIV testing and also offer risk reduction work with those who test negative. During contact tracing with the HIV positive clients, we're looking to expand on the information that we would usually gather. So we're wanting now to include more specific details, such as where their injecting took place, what area of the city centre, in particular streets, flats, houses, anything that they can remember. Who may have been around them at the time of their injecting, and not just people that they remember sharing injecting equipment with. And we're also looking to obviously identify any sexual contacts as well.
So Emma, could you tell us a little bit more about some of the challenges or the lessons that you've been learning from making a change to the service?
Absolutely. So I guess first of all, thinking about discussions around sexual health is always going to be challenging, and particularly in this specific group, because they've got added challenges such as complex social and health needs. The recall of events around the time they may have become HIV positive can be lessened due to those health and social issues, making it really quite difficult for us sometimes to get this contact tracing information. Another thing would be priorities for us all are different, but in this particular group, bloodborne viruses and sexual health usually are quite low on their list of priorities for themselves. But what we want to do is be there and be present, so when they do attend services, we get that opportunity to do some work with them, to get time and start this partner notification work with them. So kind of addressing that challenge would be the fact that we are now in the clinics where the clients are, as opposed to a clinic that is 2 or 3 miles away.
Yeah.
So that's absolutely crucial. Again, thinking about contact tracing, that's a bit of an unknown thing for most people. And a lot of the time clients are anxious about it. They think, what is this about? Why am I getting questioned about all this personal information? They might worry a bit about where that information is going to go. Will we then be looking for somebody to blame and sort of find an individual to blame for this outbreak, which absolutely is not at all our motivation. So getting that message across is really, really important. Also, they could well be concerned about the confidentiality of their own diagnosis. So it's really understandable challenges that the clients and us face together. Again, what we need to do is be there, be around, be with these clients, let them get to know us, be able to support them, tell them what the process is, and make them feel that they are in control of what's happening. Another big challenge for us, and a big focus for us, is trying to get this pool of clients who are positive for HIV but undiagnosed, is getting them tested, and our hope is that really good contact tracing is going to help us in that process. Barriers are there, the barriers that I've already talked about, but that's our focus, and that's what we're really working hard to do. Because we know that people who have HIV and are undiagnosed can become really unwell unless they get their diagnosis and their treatment. So for them as individuals, we want them to be well. And we also want to, when we think about the public health risk as well, so we want to reduce the amount of HIV in that community for individuals, but also for the wider public's benefit.
Caroline, could you just tell us more about what your work will be looking like going forward?
Yep, certainly. Well, so far we've made really good links with NHS and third sector organisations, and that has opened up the opportunity for us to start a brand new clinic within the Drug Crisis Centre, this residential detox centre, and that's been brilliant. We've really learned that actually we've got to go to the clients, the service users, so we can't expect every client even to come to Hunter Street. Mm-hmm. It also means that they are there and they'll get to know us, and it's a 21-day programme, so we'll get to see new clients every 3 weeks, 3 or 4 weeks. But the spill out from that is that we have to offer sexual health service as well. It's only right. So it's going to be a full so it is a full sexual health service, and that covers reproductive health needs as well, and blood-borne virus testing. We also, as a result of this clinic, we're able to engage with other users from other organisations like Roots Out, and people who come to the injecting equipment provision, needle exchange areas too. So that's been great. We've got strong links. We're continuing to develop the links with the SAN community, with people like yourselves, to really get the message out about what we do and how you can signpost clients to ourselves. And we also kind of hope to keep on educating the CAT teams, mental health teams, social work about the role of contact tracing and where they can fit into it, because one day they actually might get a call from us saying, would you mind testing your client, or discussing with your client about maybe doing a dry blood spot testing, and understanding the importance, and it's really important that we're all on board with that, so we can get this undiagnosed pool known to benefit their own health. So there's lots for us to keep being busy again.
And at these clinics, what kind of things do you offer?
So we offer anything to do with their sexual health needs, anything to do with contraception, blood-borne virus testing, and that can be venipuncture or dry blood spot as well. We work closely to do some of the contact tracing within the HIV clinic that runs alongside us, and the new initiative has been the Drug Crisis Clinic on a Thursday.
Excellent. And is it drop-in? Is it referrals? Is it appointment-based?
To be honest, it's dropping. We're really quite flexible.
Okay.
We are open to seeing anybody, and we're happy to take referrals, and we might offer an appointment,
Mm-hmm.
but we're quite flexible.
Flexible.
Yeah.
And Lynsey, how would people find out more about the services that you're offering, the work that you're doing and the lessons that you've learned?
So we would be delighted if anyone wanted to contact us about anything that we've discussed here today. As Caroline said, we can be contacted through either Hunter Street Clinic or through the Drug Crisis Centre, and we will also provide our mobile numbers at the end if anyone wanted to contact us about anything that we've discussed today, but also if they have a client or service user they feel would benefit from seeing one of us.
Excellent. Okay. So thank you very, very much for taking the time to come and tell us a bit more about the work that you've been doing. Yeah, thank you. And we'll put those details up so if anyone at home wants to contact to find out more or to refer in, they can do that. So thanks very much, guys.
Thank
Thank
you.
you.